He's the Executive Director of the California Budget and Policy Center.
Great, good afternoon. And I'm here today to share some remarks with you. They're from a presentation that you have in front of you in your materials, and to essentially put the data and the numbers to the CalWORKs program and talk about how there are too many of the stories that we just heard, and to put that in the context of the broader California economy. And so to start with that broader context, the economic security of low and middle income Californians in the state has been eroding over the past generations. If you look at adjusted gross income, adjusted for inflation, and you look at it over the last couple of decades, and you break the population of income earning households into fifths or quintiles, what you'll see is that the top 20% have seen about a 45% increase in their incomes over the last 2 decades, while every other quintile has actually seen their wages erode. And if you just take the top 5%, you take the 1% out of that, you see a 126% increase in their incomes over time. So the very top, a story we hear often, people are doing very well, but for literally everyone else, middle class, low income folks, you are seeing an erosion of their wages over time. And at the very lowest income level, we know that that translates into very high poverty rates. So we have a 15% poverty rate in the state of California for adults and a 20% poverty rate for children. And we know that even those numbers, which are calculated along the federal poverty line, are too low in the sense that if we actually factor in costs such as housing and other things that cost more in California, that those percentages go up. And so we have too many people living below different measures, whatever those are, of poverty. And so the question then is what that actually means in the context of the CalWORKs program, a program that's actually designed, I would argue, in response to Senator Mitchell's question, to actually lift people out of poverty, or his intent is to help them transition to work and lift them out of poverty. We've been through a number of years now where budget cuts that may have been necessary because of the Great Recession haven't been built back yet. We've made a couple of small increases in the program in terms of funding in recent years, but we have a ways to go. One of the places to start is to simply note that nearly 4 in 5 of those being served by the program are children. And so what we have is a program that's primarily helping to help lift children out of poverty, or at least in terms of its intent. But the ability of CalWORKs grants to significantly improve the well-being of families and children has been eroding both before the recession and afterwards, in large part because we don't allow the grants to keep up with the cost of living in the state. If you look at that just since the onset of the recession in 2007-8, and you look at the maximum family grant level of $704, if we just adjusted that for inflation since then, that grant level would be $884. And if you went back and you indexed it back to when the program was started, it would be up north of $1,400 a month. So much more significant support for the folks who are actually on that assistance, and much more significant support in the sense of the cost of living in a lot of our regions of the state. And some of the things that have happened have been well documented, talked about here. A number of cuts to grant levels. We eliminated the cost of living adjustment back in 2010. The reduction in the time limits in which people could receive the grants, all of that's been well covered. And like I said, in the last couple of years, made some small increases, 5% increases in the last 2 budget agreements, but still a long ways to go. And if we look to the 2015-16 budget and where we are today in the governor's proposal, what we would see is that the CalWORKs program would remain below deep poverty levels, 50% of the federal poverty line. The grant levels would be at about 41.5% of federal poverty line, so below that 50% threshold. And in response again to the senator's question about what the program is at current, the answer ends up being that it becomes a poverty maintenance program, and in fact it becomes a deep poverty maintenance program if the grants are allowed to be maintained at such a low level. And a lot of times people turn into a statistic and say, well, the grant levels are high in California relative to other states. But if you actually account for the cost of living in the state, housing in particular, what you see is we're more middle of the pack. The grant level puts us, when you account for housing costs, puts us below grant levels of about 22 other states around the country. Another way to look at it is if you add in other assistance programs. So if you add in food assistance under CalFresh, two very vital state programs that help build up our safety net, you still see that where we are today is that if you combine CalFresh and CalWorks, they're at about 71, 72% of the federal poverty line. So even two vital programs designed to help lift people out of poverty aren't at levels, if we leave them where they are today, that can actually do that. Another area what we could obviously address is about the actual income limit for when people are actually moved out of CalWorks, and the governor's proposal would also leave the income limit for receiving CalWorks below the federal poverty line. Just looking at the 15-16 number, and if you go back prior to the recession, we at least had the income limit set above the federal poverty line, and so we're kicking people out of the program before we've lifted them out of poverty. And this isn't just about spending on a program. Obviously, there are costs here. But it's about what we can't afford not to do, and about the impacts in terms of outcomes for California's families and children. Children are affected by poverty in many ways. Those who live in deep poverty are particularly susceptible to the effects of economic hardship. Children living in poverty have been documented to fall behind academically, experience greater emotional and behavioral problems, face a variety of health problems. And as adults, these children are then more likely to experience those same health problems and more, have less education, lower earnings, and live in poverty. So by not acting, we end up creating a cycle of poverty, which means we're sort of enforcing a program where people live inside the program for longer periods of time than we ever intended. So the bottom line is that whether you're looking at grant levels or income limits or when people are timed out of CalWorks, there is a lot of room to ensure that the program itself is actually meeting its intent of lifting people out of poverty and transitioning to work, and particularly during a period of time when the state's fiscal outlook is improving. So I thank you for your time, and I'm happy to take questions at the appropriate time.
Thank you so much, Mr. Haney, and grateful that you're here. It is now our pleasure to be able to introduce Will Lightbourne, Director of the Department of Social Services. Good afternoon, Director, and thank you for taking the time.
Good afternoon, Chair McGuire, Chair Mitchell, committee members. First, let me start by sort of seconding the points Mr. Haney made about all of the negative effects of poverty. That has to be all of our deep concern. I'm going to deal more with the specifics of the program, but it is always in the reference of that. When federal welfare reform was enacted in '96 and the state program was changed in '97, I then had the privilege of chairing the county director's gain committee. And that was, of course, the precursor. And we negotiated both in the legislative process and with agency and department over the specifics of the program. So I have lived with the program intimately for a very long time. And I am utterly committed that participants should have the experience that Michelle was able to describe. At the same time, I want to be, absolutely transparent that the program is built on some tensions. The federal program inherently is built on the issue of time limit, sanctions, and work. A series of assumptions were rolled together. They had not necessarily pre-existed. The California program and the federal-state relationship is built both on an assumption of some state flexibility in how we design the program, but also state accountability to the federal government on some pretty rigid measures that we may not all agree with, but they're operable. Secondly, our own program within the state is built on our state-county partnerships and the flexibilities that we give counties in the recognition that counties bring different resources to the table at different times. They have different needs, different populations, different strategies, different networks that they can pull upon. Within our own program, I think the state as a whole made a choice to be inclusive. And it is, relatively speaking, an inclusive program. If you compare, because we don't have family sanctions and we maintain a safety net and we maintain a child-only caseload. If you compare the percentage of Californians on our TANF program, CalWorks, we've got approximately 3.36% of the state population aided by the program. If you compared that to New York State, you would see 1.34%, less than half. If you compared it to Illinois, you would see 0.35. So I don't say that to say that's adequate or a justification for anything, but I say we made a policy choice as a state to be inclusive. If you look at the number of children who live below the federal poverty level in the CalWORKs program, in California it's 50%. Nationally it's about 18%. So California has maintained both an inclusive program and a relatively recession-responsive program. Our program grew when the recession occurred. If you looked at the country as a whole, that was not true. In many cases, the program declined. It will, as was noted, Mr. Haney noted, there have been multiple grants cuts over the last couple of decades. Only in the last 2 budget cycles have we had a couple of restorations. Additionally, in April, we'll become more inclusive because of the elimination of the ban against individuals with prior drug felonies. These we consider good changes, but as we become inclusive, we are balancing that against other opportunities, other cost factors. That's the reality we live in. In 2012, as everyone has mentioned, SB 1014 was enacted. Now, this always needs to be said very clearly. It maintained the adult 48-month eligibility for CalWORKs benefits. It expanded the flexibility of the first 24 months, so they no longer had to be met by the, quote, core, non-core, including the federally approved activities. It said after the 24th month, in order to continue participation, the adult was to be meeting now the federal definition, essentially unchanged from previously. All that was effectively changed there was it was very clear, and the early flexibility was created. Exemptions were maintained, and a policy allowing extensions to the 24-month for a target of 20% of people based on their near completion of activities, so that we didn't effectively clip somebody's success, was part of the bill. Additionally, the earned income disregard was increased, not quite bringing the exit point to 100%, but raising it, and again, to incentivize work. Subsequently, we worked with a wide group of stakeholders to identify promising approaches to support engagement and positive outcomes. And this took about a year and produced SB 74. I have to emphasize that SB 74 was not a precondition to SB 1014. It was intended as something that would help support that effort. But we always keep improving the program. We always keep innovating in the program. At the time we did SB 74, the housing support program hadn't been created yet. That's new to that. I fully anticipate that in years to come, we will identify other promising practices and adopt them. I would completely stipulate that many of the stakeholders we worked with had underlying policy disagreements with the administration, but they engaged deeply with us, and I would say that the process of implementation has been extensive and transparent. I would use those words in place of a word that appears on page 2 of the staff report. I'd like to, now doing that sometimes adds time, but doing it right and doing it fast are not always synonymous. And I'd like to review just a couple of items from the staff report, just for purposes of clarification. On page 2, there's reference to a September 2014 letter, regarding possible time limits described as in conflict with other implementation goals. In fact, the September 2014 letter was issued at the request of the counties, at the request of stakeholders, at the request of some of the participating ledge staff in the stakeholder process, to spell out that the 20% extensions were guidelines, that there was a process for doing it, that we would be working with counties on a rolling basis to do it. It was not a start this. The other letter that was issued that month regarding family stabilization wasn't the switch on family stabilization. That had been done the prior February. Rather, it was simply transmitting a form that counties could use to indicate when services had been turned off for family stabilization. So I just want to sort of spell this out, that we have to keep updating information, we have to clarify, we have to issue those sorts of field instructions, or we disadvantage the program itself. If those become somehow evidence that the program is not moving smoothly, then we've put ourselves in a trap of our own making that I don't think we want to be in. Page 9, there's discussion, as the chair mentioned at the beginning, of the OCAT process. I just want to sort of observe sort of 3 points. I think the original date that we estimated its availability was over-optimistic. That was premised on a lift and shift of the existing instrument. When the stakeholder groups saw the instrument, they were very enthused about it, but they felt it had to be customized for California. That has taken time, and user testing has taken time, and the piloting in counties has taken time. However, the third point I'd make is that counties have always had appraisal and assessment instruments. These have always been used to guide clients' access to the mental health services that have been funded in this program, to the substance abuse treatment services, to the domestic violence treatment services that the program has always had. On page 9, there is an incorrect statement that a county deferred implementation of family stabilization because OCAT was precedental to family stabilization. In fact, the county, along with many others, submitted an implementation plan in February 2014 saying that they were implementing as of that month. Given that family stabilization funding can be used for housing assistance, it's sort of incomprehensible that it would be withheld consciously. There is a question about how the originally projected 7,900 people who would reach time limits in 2015 was recalculated. Just to clarify that, the original number, because the only instrument we had from which to calculate it was the 48-month clock, that was calculated in April of 2014 and was carried over in the January budget because the final input of the 24-month data automation systems in some counties didn't occur till this past October. When the governor's budget was issued, our staff briefed ledge staff and said that number won't be real, it's much too high. In fact, no one will reach the point where they could possibly be considered to have expired until April, and then there's 90 days of conciliation.
Director, I just don't mean to interrupt.
Right.
We're hitting a little bit of time, so
Let me skip to the last point.
I apologize.
Of course, which is the question of work participation rates and how, are they real or unreal. The data, I think, needs to be clarified, which is, first, penalties are real. The state failed the 2008, 2009, 2010, and 2011 requirements. The 2008, 2009, 2010, 2011 have been appealed, and the appeals have been denied. We're under a corrective action plan this year to make good on 2008, 2009, 2010. If we do not, the state faces $341 million in penalties through the reduction in the TANF grant. And the concession we got from our federal partners was that we would have an extra year to make good on 2011. If we don't make good on that, there's an additional $240 million penalty that comes due, a total of $600 million. I don't want to see $600 million come out of programs for the poor in California. And I don't know it would be a priority that's where we'd want to spend money. In terms of where we are at this point, We're not yet at the 50% target. If we steady state where we are, we're at 48.9%. To get to steady state, to get to the 50, we're counting on increased participation in some of our counties. If we achieve that, then we clear the bar and we're able to not have it. So to conclude, we are working with, we'll be working with our counties to look at any obstacles they're finding. We're working with the WIOA implementation process to try to attach our subsidized employment to their OJT, apprenticeship, skill certification classes. We have been doing the on-site reviews with counties. County peer reviews start in the fall. And Rand Corporation is doing the evaluation due in 2018. I think we just have to keep our message clear that we are implementing in every way we can in California. Thank you.
Thank you so much, Director. I know that I'm sure that we'll have questions and comments here in just a bit, and do appreciate you being here again, sir. Our final panelist on our first panel is Ryan Woolsey, and he's the Fiscal and Policy Analyst with the Legislative Analyst Office, and we're grateful you're here, Mr. Woolsey.
Thank you, Mr. Chair. Ryan Woolsey with the Legislative Analyst Office. Today I've been asked to review some of the recent Welfare to Work program changes, so a little bit narrower scope than some of the comments that you've just heard, changes that were enacted in 2012 and 2013, and what some of the possible expected outcomes we might see from those changes are. And then next I'll walk through a preliminary look at some trends in Welfare to Work data since those changes were enacted. In the interest of time, I'll just very briefly review specifically which program changes we considered in doing our handout. On page 1, you'll see some of the major changes that were included in Senate Bill 1041 in 2012. First, there was a reduction in the minimum weekly hours of participation for Welfare to Work participants. Next, there was increased flexibility that the director mentioned for a period of 24 months, after which certain restrictions that pre-existed go back into effect on certain activities. There was an elimination of some short-term exemptions for certain cases that had young children. This allowed these cases to not participate in Welfare to Work activities, and that exemption was put into place to allow counties to manage a significant reduction in their funding during the recession. So those were phased out. And then, as was mentioned, an evaluation of the effects of these changes was required, and that is expected in 2018. In the following year, in Assembly Bill 74, additional changes were made, including the creation of the Family Stabilization Program. Additional funding was provided for subsidized employment, and the Department of Social Services was required to develop a standardized appraisal tool for the whole state. Lastly, there was some statutory clarification around flexibility in the first activities that Welfare to Work participants can do. Previously, there was an understanding that the first activity should be typically to search for employment, but the statutory clarification emphasized that there are other options available, including family stabilization. On page 4, we'll list some of the potential outcomes that we might expect to see from the changes that were enacted in 2012 and 2013. First, we would expect to see an increase in participation in Welfare to Work. This is primarily because many participants took those short-term exemptions, and as those exemptions phase out, more people are required to participate in Welfare to Work. Next, with respect to sanctions, some program changes might be expected to increase sanctions. This is primarily because as people that were exempt become required to participate, many will participate, some will not, and will be sanctioned. That would increase the level of sanctions. On the other hand, several of the other changes, specifically increased flexibility in Welfare to Work activities, family stabilization, better identification of barriers to employment, would be expected to reduce sanctions. It's not really clear over the short term which of these would be expected to be greater. Next, we would expect there to be an increase in child care utilization, the number of families receiving child care, just because more people being subject to the work requirement would mean more people receiving child care. And finally, we might expect that increased identification of barriers to employment might lead to an increase in barrier removal services like mental health or substance abuse treatment or domestic violence services. On page 6, we note that it is truly very challenging to evaluate the outcomes of these changes simply because, on the one hand, there's not administrative data available on all of the outcomes. We do know a little bit about how many individuals are participating in the different types of activities in a given month, but we don't know a lot about the barriers to employment, how often they're assessed, or even over a period of time, what happens in the life of a CalWORKs recipient. But perhaps more importantly, there are many, many factors that contribute to the trends that we see in welfare to work participation. Most importantly, the economy. It's difficult to sort out when you see a trend in administrative data whether that change is caused by changes in the labor market or because of changes in state policy. And this is complicated again because implementation of some of these changes is ongoing, is still in the works. So with that, on page 7, we'll take just a preliminary look at some of the trends in welfare to work participation. On page 7, since December 2012, the number of individuals enrolled in welfare to work increased from about 155,000 to about 182,000, or a 10 percentage point increase in the share of all adults. At the same time, exemptions are down from 131,000 to about 84,000. That's a 13 percentage point decrease. Sanctions are up from about 51,000 to about 60,000, or a 3 percentage point increase. On page 8, with respect to the mix of welfare to work activities, we can see that since December 2012, the share of participants engaged in unsubsidized employment increased by 3 percentage points, while participation in vocational education, which is often at the state's community colleges, is down by about 2 percentage points. Participation in subsidized employment is up by about 1 percentage point, and this is to be expected given the funding that was provided for additional slots. Changes in participation in certain barrier removal services are mixed. We have slight decreases in participation in mental health and substance abuse services, but slight increases in domestic violence services. On page 9, with respect to child care, we see that since October 2012 and to October 2014, child care utilization is up by about 2,000 additional families participating in child care. And I'll note that this includes stage 1, but also a portion of the state's stage 2 child care, which does provide subsidies for some current CalWORKs cases. This leads to a relatively constant take-up rate among eligible families, meaning that as the number of eligible families increased, because exemptions came out, the number of people in child care increased with it. However, the stable take-up rate of 29% does appear to be low, given that child care is provided as an entitlement for families that are participating in welfare to work. In summary, as I mentioned before, currently available administrative data do not allow us to make conclusive findings about the outcomes of the recent welfare to work program changes because of the many factors that could influence them. But they do highlight some interesting trends that we think merit additional study and discussion. These include what appears to be a longer-term increase in the number of sanctions that appears to predate some of these welfare to work changes. Another is the slightly decreased utilization of mental health and substance abuse services. And finally, the ongoing low rate of child care utilization among participating families. It would be good to look into those further, but at the end of the day, the legislatively mandated evaluation that's due in 2018 will collect data that's not regularly available and should provide additional insights into the effectiveness of these outcomes in 2018, and the department has indicated its commitment to provide additional updates in the meantime. Thank you.
Thank you so much, Mr. Woolsey, and for that comprehensive report. Grateful. It is now time for the senators to be able to ask questions and comments, and we'll start to my right with Chairwoman Mitchell.
Thank you, sir. Where do I start? Let me just start by saying Director Lightburn, I agree that, as you said, doing it right and fast is not always synonymous. We agree there. I guess the point where we then disagree, with all due respect, sir, is because we want to do it right, then the stick should not be rendered before the program is fully designed up and implemented. And so the clock, from my perspective, simply should not have started until the full program was up and running. And the charts I've seen, I think, from your department do show sanctions with an increasing number in the next year. And the sanction indicator for me is not that I don't believe that there are people who should be sanctioned. That's not the case, but monitoring the sanctions as they ebb and flow, their trends, I think is critical because it's an indicator. It's an indicator either of a change in landscape, i.e. an increase in unemployment rate, a change in the need of recipients. It's an indicator. And when they drastically change as a result of a policy change that we have in effect put in place, I think that's an indicator of a problem, ultimately. So that's why the monitoring the sanctions, I think, is very important. As I sat here and listened and thought about conversations I've had with Mr. Bland, I've had with others in the audience representing the county and advocates, if I could get a redo, quite frankly, I would not have voted on the 24-month clock. And that's a tough place to be as a policymaker who takes her job very seriously and takes the oath I take to the constituents in my district very seriously. I wouldn't have done it. We have had numerous conversations. We all go back and forth about what it did, what it didn't do, what our intentions were, what our intentions were never agreed upon. Ultimately, I think it was bad policy, and I'm sorry that I will go down in history as having supported it. In that I don't get a redo, I think we have to continue to talk about how quickly it can be implemented at your level down to the counties where people are trained and the tool is utilized, and recipients like Michelle who's joined us today experience the early intervention as it was designed, so the 24-month clock doesn't create harm for California's children. It's clear to me that that's my only opportunity now as a policymaker to continue to hold you and the department accountable and continue to have the conversations to figure out what we need to do so it is done right, it is done much more quickly, so the sanctions don't continue to bring harm to Californians. To the LAO, I was reminded in your summary page of our experience when welfare reform was made operational in California, and the welfare rolls, if you will, began to drop pretty drastically, and everybody kind of patted themselves on the back and felt it was a success. And there were some people who said, well, but where are those people going? Yes, they're off the welfare rolls, but we don't know if they've landed. And when I then moved into subsidized childcare, I realized, yeah, not many of them landed in an ideal place because the stage 3 numbers stay high, which means that they continue to be income eligible for the child care subsidy because they didn't go off and get a job that pays them a livable wage to allow them to afford their child care over time. So we weren't measuring the real outcome, which is probably why we now have the highest child poverty rate in the nation. So looking at your second point in terms of the data that we should begin to dig deeper in and looking at those trends, I would suggest that that is something that the legislature really needs to take seriously, having learned from that previous experience, that if we don't set up an expectation to measure data on success and define success at the front end, we won't know if we've gotten there or not at the back end. And we'll continue to be trying to take a temperature, which is the sanction, take a temperature and looking at the child care uptake and not know the real core issue if we haven't set out and defined success in the front end. I think that's all. Just those rhetorical